We'll be speaking today about children and youth and discussing mental health with them. So first, our affiliations, I just wanted to touch upon a group that I'm a part of called Stigma Enigma. We raise money for child and adolescent services at Maryvale. So that's my biggest affiliation that I just wanted to disclose. And of course,
yes, and I'm with Hotel de Grace Healthcare. I have all the mental health and addiction services starting all the way from 6 years old to wherever life may bring you, so across the life continuum.
So let's get started. Before we begin, I want to quickly touch base on some important definitions to know before we continue on with today's topic. So first is mental health. So I'm sure everybody has heard the word mental health, especially right now. It's a hot topic. So as you can see, it's defined as a state of well-being in which every individual realizes his or own potential. They can cope with normal stresses of life, and they can work productive and make contributions to our society. And next we have stigma. So stigma is a really important definition to know. As we know, mental health is stigmatized quite frequently. So stigma is a strong feeling of disapproval, and most people in a society have about something, especially when this is unfair. And then finally we have a mental disorder, which comprises of a broad range of problems, different symptoms, and it's a combination of abnormal thoughts, emotions, behavior, and relationships with others. For example, depression, schizophrenia, bipolar disorder, and so on.
So the next is going to be a little bit about stats and really understanding the climate and the landscape of what are trends looking at. And when we really start to pay attention to these numbers, it's actually quite profound. So it's telling us that more individuals will need some kind of assistance or will get touched with a mental health related issue at some point in their life. So the earlier we can start having these conversations, the better it is for everyone.
I just really want to highlight that 63% of youth point to stigma as the most likely reason not to seek help. So that's why it's important to normalize, the conversation, talking about mental health from a proactive perspective, such as taking care of the mind, body, soul, thinking of it in that perspective, as well as normalizing the discussion of, depression, anxiety, other symptoms like, phobias, fear, nervousness. So having that open discussion and normalizing it with your youth.
Even when you think about 70% of mental health problems have their onset during childhood. So again, like every other condition or illness, the sooner we can intervene, identify it, the better the outcome is for that child and as they move into adulthood.
So it all begins with you guys, the parents and guardians, grandparents, aunts, uncles. So what I want you guys to do is ask yourselves these questions before you engage in a conversation with your child or adolescent. So how much do I know about the topic or the mental health discussion or topic that you want to bring up, whether it's depression, anxiety, or so on? And then how comfortable am I with speaking about this topic? So challenging yourself and acknowledging how comfortable am I really with talking about mental health? And then finally, do I have stigma attached to this topic? And again, challenging ourselves, okay, what do I really think of somebody with depression? Have I ever judged somebody based on, let's say walking down the street and you notice somebody's talking to themselves? Have I ever judged them? So challenging yourself, asking yourself these questions, and then kind of shaking it off and becoming comfortable with the topic, which comes with where to start, which is education. So noticing what you want to talk about or acknowledging, how much do I know about the topic? How much do I not know? And then educating yourself. So here's a list of awesome websites. I've been on them personally, gotten information off of them. They're great. Also, the Greater Essex County District School Board website has a ton of resources. I highly recommend you guys check it out. I definitely did. So items to think about prior to starting the conversation. I already touched on the most important one, which is education. So first, we're going to talk about setting up the environment and creating a space for discussion. So everybody's going to take the conversation differently. Every child, every adolescent's going to either want to talk about it or is not going to want to talk about it. So sometimes, whether it's sitting down at the couch, in the room, wherever, finding a comfortable, quiet space. Other times it may work to bring it up in the car while you're driving, doing dishes, doing sweeping, cleaning up. Let's do some housework and talk about mental health. So it really depends on the child and adolescent.
It's really being able to meet where your child or adolescent, wherever they are at. And the more you can make that comfortable for them, then the easier the conversation will be, recognizing it's not an easy conversation. Because when we think about it, and when we say it, and when we put it out in the universe, we're acknowledging, and that's half the battle, acknowledging that there is a problem, there is something happening here. And often, the case is that that child or adolescent, they're not feeling okay to begin with. Something is going on, and usually we'll talk a little bit more about how it manifests and what are some of the symptoms that you might be able to observe to use that as your hook to make that connection.
Next, we have engage and encourage. So you want to engage in the conversation. You want to encourage the conversation. At the same time, you want to respect your child. So if they're not ready to talk about it, listen, that's okay. Not today. We'll try tomorrow. So just being really mindful of where, again, your son, daughter, niece, nephew, grandchild is at that day. And then finally, we have age-appropriate language and examples. So again, when talking about mental health, and if you're going to use examples and the language that you use, making sure that it's age-appropriate. Whether you're talking to a 5-year-old or an 18-year-old, there's going to be a huge difference on how you're going to communicate with them. So keeping that in mind, and we will discuss this a little bit later. And then finally, being honest. So if you don't know the answer to something, it's totally okay. Be honest with your kid. Tell them, let's say you don't know the answer to a question, just say, I don't know. However, let's find out together. Or I don't know, but you know what, I'll look that up for you. So making sure that your child knows that it's okay not to know something. Also, you can make it an activity with your child. So let's look this up together. Let's read a book together. Let's learn together. It's also creating that bond between you and your child.
It's really creating that atmosphere of acceptance, that whole unconditional, I accept you as you are. And the more you can instill that in that child and normalize that, the more likely that they'll be able to trust you and disclose and have that conversation with you. Because the fact of the matter is, these are very real issues. And often, just think about that whole life course, whether it's a young child or as you're getting into the adolescent age, that again, you're really trying to find yourself into this world, and all of a sudden you have all these other feelings that are going against what you might be observing. So there's a lot of fear associated, a lot of fear for you and a lot of fear for the child.
Finally, in the words of Taylor Swift, shake it off. So this point I wanted to make is, if you are feeling uncomfortable or if you're just not feeling it, just do one of these. Shake it off. Shake it off and sit with yourself and feel how you feel, because we need to practice our mental health and being healthy mentally before we can have these discussions. So just shake it off. And then each conversation I mentioned earlier should be appropriate to the age of your child. So we're going to briefly talk about younger children. So less specific information is usually needed due to the inability to understand complex explanations. And then young children will usually focus on what they see from a day-to-day basis. This can usually include bizarre behavior. Let's say it's a mother, father, brother, sister, aunt, uncle that is behaving in a specific way. Or let's say they see mom and dad that's really sad, brother, sister crying every day. So these are some things that younger children tend to focus on more. Also keeping the explanation as simple as possible. And then younger children will tend to be more afraid and guilty. Next, we have school-age children. So these children tend to ask a lot more questions than your younger age. So prepare to answer questions. This is where that do your research before you talk to your kid kind of comes into play here. Also, safety will most likely be a concern for this age group, especially if mom, dad, brother, sister, and uncle have either tried to complete suicide or if there is self-harming behavior that they've witnessed. So usually safety will be a concern for these kids. Also, a more detailed explanation, obviously, as the kids grow up or older, will be needed. And again, it's important to use age-appropriate language, age-appropriate examples, and let the child decide the flow of the conversation. And then finally, teenagers. So teenagers are going to have a lot more questions, or they may have no questions. It's kind of that in between. They probably are familiar with what mental health is, what the different disorders are, and everything that kind of encompasses mental health and addictions. They've probably heard it at school through friends, so the conversation will be a little bit different. Again, this age group is going to have a lot of questions, and they can use, or you can use a more complex explanation for the diseases that you're discussing. Also, older kids tend to feel more angry and embarrassed. So again, targeting stigma and discussing stigma with your kids this is a great opportunity too.
When you're talking about the teenage ages, sometimes as they're developing and it's hormonal and such and everything else, it's sometimes difficult to distinguish, is this a normal adolescent behavior or is there something else going on? So you're always trying to balance that, because often as parents or caregivers, you tend to write it off, or what, they've just had a hard day, they've had a hard month, they've been struggling with this, that. We tend to want to block those conversations out and apply some other reasoning to why this is happening. So it is very important, again, to be asking those questions, even if it is just typical adolescent behavior.
Effective communication is very important. So I wanted to highlight some of the how to clearly and effectively communicate with youth. We have clear communication, listening to concerns, being attentive, so making eye contact, nodding, showing your child or adolescent that you are actually paying attention and listening to them. Also, being aware of your own tone and facial expression. So sometimes when we're talking, we're in the heat of things, and next thing you know, you have this crazy facial expression. You're just like,
or a face of disappointment.
Exactly. And then showing empathy. So putting yourself in your child's shoes, and then looking for common goals. So what do you want to achieve out of the conversation, and what does your child want to achieve from the conversation? This usually is more important, I guess you'd say, in the teenage years. And then using humor when appropriate. You don't want to throw in a joke when it's a serious conversation. Let's say your child is coming to you, telling you something that happened at school or how they're feeling, and then to use a joke sometimes can be inappropriate. So again, using humor when is appropriate. And then finally, staying away from slang. So I know you want to be hip and cool and connect with, usually as teenagers, you want to use slang. However, trying to use language that you're comfortable with, because sometimes the slang can come across as, non-genuine, kind of being fake, and you don't want your child to think you're being fake. So just sticking to the language you're used to using and staying away from slang. So these are the 3 scenarios we're going to briefly touch upon. So a family member has a mental illness, how to approach that conversation, and then your child or adolescent has mental illness, and then finally just general mental health discussion. Okay, so for child and adolescent with a mental illness, family support is one of the most important factors when considering positive outcomes from children diagnosed with a mental health disorder. So youth really, really depend on you guys. Especially when it comes time to dealing with mental health issues. Also, as we already know, good communication between your child and you really does enhance the relationship.
As a provider, one common thing I would see and encourage is every step of the way that your child is at or adolescent, make sure you're right there beside them. And I often, these journeys are very difficult, as some of you can imagine. And it's easy to be able to kind of detach or say, just come and take care of this. Just go and take care of it. I'll support you. I'll give you everything you need. But you have to have that connection, because whatever your child learns, you need to learn along with them.
So I wanted to touch base on child and adolescent mental health. So what really is child and adolescent mental health? We went through these 3 definitions in the very beginning. However, I wanted to touch base on this topic. So it is the social, emotional, and behavioral well-being of a child and adolescent. It is considered an integral part of healthy development. So just as physical health is extremely important, we're always seeing our family doctors, making sure our kids are eating right, sleeping, Going to school, mental health is just as important. So noticing that your mental health is just as important as physical health. And by having these open discussions with your children, then they will start to notice that and acknowledge that. So when, your son, daughter, niece, nephew, grandchildren are feeling sad, they'll come up to you and they'll tell you. They'll know that it's okay to vocalize these feelings and that no feeling is wrong or right. So next is the parent-guardian role. Basically, we've already talked about it throughout this whole presentation. Parents are usually the ones who seek out all the services to help their children. Most kids, they don't know where to go. A 6-year-old, 7-year-old, even a high schooler, they're not going to know what to do, where to go. They may have heard from a friend or a school counselor or a teacher, but usually it's mom and dad, grandma, grandpa, whoever is taking care of the child is going to be the one that's seeking out these services. Also, it's important for parents to know that families are not to blame. It's no one's fault. And finally, learning and understanding mental illness can help eliminate guilt that a parent or guardian has. So the more you guys learn and learn with your child, the less guilt usually parents have. And then a parent's positive relationship with their child and adolescent actively promotes the mental health of their child and adolescents. So again, keeping that positive environment, having these discussions. So here are some conversation starters. First is observation. So tell your child what you're observing. I've noticed you're not doing your homework, or you're not hanging out with so-and-so and so-and-so anymore. What's going on? I've noticed that you've been spending a lot of time in your room. Is there something that's bothering you? Do you want to talk to me about something? So by telling your child or adolescent what you're observing may bring some insight as to what could be happening. Also, there's screening. So there's a website, I have it up here. It's the mhascreening.org. It's an easy website to use. You can do the parent screen, or you can have your youth do a youth screen. So that's also available. And then you guys can sit down and look at it together and see, okay, actually, maybe I am not feeling so happy and I'm sad most of the time. Okay, so then what's the next step? Where can we go for help? Who do we need to call? And then information, which we discussed earlier. So again, doing the research, looking things up together. So what does the community have to offer? Who do we have to make an appointment with? And then finally, experience. So sometimes giving some of your experience or sharing your experience with your child can be helpful. Obviously, keeping in mind age and appropriate examples, as always. However, telling your kid that, when I was your age, I felt sad sometimes too. And this is what I did. Or, I get really nervous when I have to do a presentation. It's about being real and honest with your children. Again, normalizing our feelings. And I guess that's the most important thing, is that it's okay to not be okay. And then next we have common warning signs, which...
So when you're considering the common warning signs, and of course these can variate through child and experience, often it's the reluctance to separate from mom or dad, in particular when they're younger, of course. You can't get them to go to school, you can't get them on the bus, you can't, they're calling, they want a sick day, or they're calling, to get picked up. Decline in school performance. So you're looking at this, and this happens across the whole age spectrum, is that decline in their functioning at school. Often we see lots of aggressive behaviors, the whole acting out and the tantrums. And tantrums, of course, actually occur in young adults as well. They just look a little bit different. A lot of hyperactivity, like they're extremely agitated by everything. You can't even talk to them. You can't even ask them, how was your school day? They'll just kind of go off on you. And again, as we're thinking this through, and when you're looking at the adolescent side, it is very difficult to see that, adolescent behavior, or is there something else going on? Always allow yourself to ask the next question. Don't just stop, because it's easy to stop, because again, that's dealing with our own fears as adults. So there's sleep issues, nightmares. Sleep issues can go both ways. Can't sleep, too much sleep. Persistent disobedience or aggression, just the constant, being defiant. You say blue, they say purple, whatever it is, up, down. withdrawal from activities, family, or friends. So they don't want to go anywhere anymore. They're just hating everything that has any type of social interaction, social component to it. Refusing to go to school, I mean, that's one of your hallmarks, again, across the lifespan. And in particular, what you need to pay attention as the child ages, and you think an older child or an adolescent, but unfortunately we see this in much younger ages where there is the start of the substance abuse or use, and really dabbling into other ways of trying to find themselves some peace. A lot of times, we've have so many documented cases where kids, because they're starting to hear voices and no one's ever asked them that they're hearing voices, that they will start to self-medicate. So very common phenomena. Inability to cope with daily activities and problems. Just poor ability to be able to even troubleshoot on a day-to-day basis. Everything just frustrates them. Everything is a blow-up. And pay attention to appetite and, again, those sleep habits. Sleep habits are hallmark. And we also know that as adolescents, as they're developing, that adolescent brain really doesn't truly develop till about the age of 26. So sorry for those who are under the age of 26. It does take that long. And when you ask your child, why did you do that? And they look at you and tell you, I don't know, they truly don't know. They just do.
So next we're going to talk about a family member with a mental illness. So a lot of the discussion that we had earlier on pertains to this section, especially with the clear, effective communication and the conversation starters. So first, children are just as confused and scared as adult family members. And your child needs information and an explanation, definitely, as we mentioned multiple times, appropriate to their level of maturity. So we can't just ignore the fact. Let's say mom, dad, brother, sister, grandma, grandpa is depressed. The child needs to know, they need to be aware that, grandma doesn't want to come over today. She's not doing so well, or they're in the hospital. It's about being open and honest. The more open and honest you are, the more we're normalizing the situation, and therefore we are ultimately decreasing the stigma. Next, what to talk about. So sometimes it's really good to start with an open-ended question, such as what they think is happening, or why do you think this is happening? An example could be, so why do you think, let's say, your older sister is behaving this way? Then they'll be able to start the question and they can formulate their thoughts and their feelings.
Rather than a question like, how do you feel? They'll say, fine, and walk away. How was school today? Good. Walk away. What did you do? Nothing. Those are your closed-ended.
Next, we have feelings. So ask and ask and ask until you're blue in the face and they tell you how they feel. Expressing how you feel is extremely important. And again, always telling your children, doesn't matter how old they are, that no feeling is a wrong feeling. We all feel, we're all human beings, and it's okay. It's okay to feel sad. It's okay to feel nervous. It's okay to feel guilty. And it's also okay to feel embarrassed. It's just about acknowledging how we feel and then talking about it and how can we feel better. Next, we have, again, the whole education piece is you can start off with, well, what is mental health? What is a mental illness? And then going from there. And then reassurance that, everything is going to be okay. Reassuring them that, maybe dad is behaving this way, but just know he's not feeling well, and that he does love you. And then again, it's not the child's fault. So usually, as we mentioned, that younger age group, they're gonna feel guilty. They're gonna think it's their fault, where we all know it's not. So making sure that you really, really stress that with your kids and tell them that, just because dad is behaving this way, it doesn't mean he does not love you. Dad is just not feeling well. No different. You can use examples. No different than when you had the flu and you were vomiting, you had a fever, you felt terrible. And what did we do? We brought you to the doctors, you got some medicine, and then you felt better. Well, you can say dad isn't feeling very good. He's not, but his not feeling well is a little bit different than how you did not feel well. And, dad's at the doctor's, or he's going to see a doctor and he's taking medication and he's really trying to get better. But dad loves you. So really stressing that. And then finally, stigma, which we'll discuss a little bit later. We talk a lot about stigma because it all comes into play. By decreasing the stigma, we can open up and have these conversations. And then finally, answering those difficult questions that your kids will ask. I think this is more younger kids may ask these questions more common than like your teenagers. For example, a child may ask, why is mom and dad acting this way? Be truthful, be honest, tell them why. And then, is it my fault? Can I catch it? This is a common question that younger kids usually ask is, can I catch depression? Can I catch anxiety? So no, you cannot catch it. And then we have, will they always be this way? Do they still love me? And why is this happening to our family? So these are common, difficult questions that your kid may or may not ask.
So it's helpful for you as you're having this conversation to be prepared, and that's the part you can have that script in your head or in your mind if these questions do come up. As much as you want to keep the conversation very natural and honest, you also do want to be prepared.
So next we're going to touch base really quickly about trauma. We could talk hours about trauma. So I just want to leave you guys with a definition. Trauma, a deeply distressing or disturbing experience. So this comes into play if a child or adolescent witnesses something traumatic such as a suicide attempt, bizarre behavior, violence, self-harm. So it's extremely important to take the time and acknowledge the event and discuss it with your child or adolescent, and also to ensure their safety, because their biggest concern was most likely going to be, am I going to be okay? Am I safe? So next we have stigma. So not all people will understand what a mental illness is. And I put this in the section, or we put this in the section of a family member has a mental illness, because especially young kids, they're not going to understand when let's say they hear people make fun of, mom, dad, brother, sister. They're not going to understand that other people don't understand what a mental health issue is, or some people may not, and therefore it's going to come out and, they may be teased, they may be made fun of. So it's also about preparing your child about the reality of things and how to answer, difficult questions when young kids are coming up to them and asking them questions about their family member. So an example, what you guys could do is run through a couple scenarios with your kids and how to answer back. So let's say somebody asks, oh, what's wrong with your brother? He's really weird. He's acting weird. And it's just rude. You can have this discussion with your child and practice kind of a script on what to say back. So an example would be, my brother has an illness that makes him act strange at times. He is taking medicine and trying to get better. It is really hard for me, so please don't tease me about it. So when your kid has a kind of a script in the back of their head to deal with these situations, then it makes them feel more relaxed, more calm, and then it gives them the confidence to talk about it. And then this could be an opening conversation for your child to have with their friends and to educate them about mental health and mental illnesses. Again, the circle goes back. We're decreasing the stigma and having these difficult conversations.
It is about empowering the child, and equipping them, because as much as they become part of their environment, whichever way you look at it, and the more we can empower them at a younger age, then again, they'll be able to defend and also do a teaching element, because there's a lot of strength and a lot to be said about a child that says, just stop. Stop, that's not okay.
So next we have mental health discussion in general. So this is the perfect time to engage with your child or adolescent and educate them on mental illnesses and how they can be supportive to their friends or other distant family members. Also, anytime somebody wants to bring up mental health, it's a great time to talk about it, whether they're asking you for advice about a friend who's having a problem, or if a cousin, or if they just learned about it in school. Let's say they come and tell you, Mom, Dad, we learned about A, B, C, D. It's a great time to bring in the discussion. So when should you start the discussion? Mental health should be an ongoing conversation. The key thing, especially talking to teenagers, is that you are the role model. So if you model yourself taking care of your mental health and being open about it, then your child will model that. So I think that's the most important thing, is that they're watching you. They're watching your every move and they're learning from you. So it's a good time to reflect on ourselves. And, when we're feeling frustrated, let's say, my son didn't do the dishes when I asked him 10 million times. Instead of, blowing up and being angry and frustrated, showing your son that actually, you know what? Take a breath. Okay, you know what? Little Jimmy, I'm a little disappointed you didn't do the dishes tonight. How about, you do them right now, or next time I would like you to have them done before dinner or before this or before I get home. So, by you practicing, staying calm and taking time for yourself, then they'll...
Exactly.
Yeah.
It's don't ask why. Why didn't they do whatever the circumstances? Ask. Don't make assumptions. And if they're not feeling well in that moment, then capture it. So again, if people are feeling anxious, if they're feeling suicidal, if they're feeling all these other emotions, they're not going to be wanting to do dishes. And what it's going to appear is that this child is very defiant. And in essence, they're struggling. And that's the last thing on their mind, is to do the dishes or whatever task is up in front of them.
Also, it's important to stress that everybody has bad days. It's part of being human. But it's about recognizing when these bad days are bad days and when, professional intervention is needed. So next, your child or adolescent comes to you with a mental health concern, which again, we've been talking about this all evening. But quickly to go through is take their concerns seriously, take time to listen without judgment. Your child may tell you stuff you don't want to hear, but just again, try and being as objective as possible and just listening to them. Otherwise, they're not going to trust you. If they can sense that, you're being judgmental, you don't have time to listen to them, they're not going to talk to you.
And don't show your expression, because that's going to give away exactly what you're really feeling. Just hold it back till you're able to really understand what's happening to the child.
And sometimes just asking your kid, well, what do you think you need? How do I put this? Sometimes parents like to take control and then pick everything, decide everything. This is a good time to ask them, what do you think you need? Your child may have the answer to your question. They might say, you know what, Mom? I talked to Mrs. So-and-so today and I felt better and she's willing to talk to me every Friday. Or, I went to the school counselor. I was given this pamphlet. I was told about this service that the community has. So ask your child what they think they may need. And then don't worry about having all of the answers. So that's one thing. It's okay if you don't know. I know we talk about it a lot. Again, just being honest and going from there. And then offer alternatives. And then talk about safe situations to share personal information. So this I'm not going to go too much into detail, but this pertains to social media. So making sure that your kid isn't putting themselves at risk for bullying, let's say posting things on social media. Don't get me wrong, can be a great thing, but being aware of when it's appropriate and when it's not. And then, of course, seek outside help if it's needed. So again, a couple key points to review is listen, support, learn together, normalize the situation, and assure that information is confidential. Let's say you're talking to your one son. I don't think he wants his sisters to know about this. So really stressing and ensuring that, this is just between you and me. And then prepare to advocate, because you're going to have to advocate for your kid, whether they need special services or they need to see a psychiatrist. You're going to have to advocate for them. And then a really important discussion is just to have general mental health discussions. So what makes you feel good? We are always talking about the I don't want to say negative side of things, but I guess we could say the more prominent things that come up in mental health in youth. And we need to talk about the positive side of things, such as what makes you feel great. When you're feeling stressed, what do you do? What do you enjoy? A couple of things are, we have learning to manage stress, getting involved in school extracurricular activities. Sleep hygiene is extremely important, especially in kids. And then independence, so allowing them to feel independent and confident. And then resilience, relaxation. So what do they do to relax? And then mindfulness, being mindful of how they feel. Be and have a good friend. So being there for your friend when they need something. And then avoiding drugs and alcohol. Limiting social media and technology, even though it's very difficult to do. And then being kind to yourself and get help when needed. So I want to leave everybody with this quote. It is, there are really only 8 kinds of people affected by mental disorders. It is a very small list, but we all know someone on this list. Someone's mother, daughter, sister, wife, someone's father, brother, husband, or son. In other words, people just like us, just like you.